Okay, let's jump right into this explainer. I want you to just take a deep breath with me for a second, right? Because we have all felt that late night kitchen table stress of trying to figure out Medicare for an aging parent. You know exactly the feeling I'm talking about. You're sitting there at 11 p.m., bleary-eyed with 3 browser tabs open, one for Medicare, one for Covered California, one for Medi-Cal, and you realize you are staring at an entirely new language. You're not alone, and you're not behind. Almost no one actually knows how this works until the exact moment they have to. So today, we are going to build your family map. You're at the doctor's office, and the receptionist casually asks, "So, what's her Medicare plan again?" Boom. That is the terrifying question that jolts so many families into realizing that Medicare isn't just one simple little card. You probably froze, thinking, wait, isn't Medicare just Medicare? One thing, one answer? But as you quickly find out, it's actually a giant puzzle of choices, networks, and timelines. So, to get our bearings, we're looking at 5 main stops on our map today. We'll decode the alphabet soup, look at the fork in the road, check the enrollment clock, see exactly what isn't covered, and finally, build your family's action plan. Starting right off with stop number 1, decoding the alphabet soup, federal rules versus California reality. Now, you have to keep in mind, while Medicare is a federal program, how it actually plays out is shaped entirely by the fact that you live in California. We've got our own unique landscape of plans and networks here. So let's break down these parts. First up, Part A. Think A for admissions. This covers all the big, inside-the-hospital stuff: inpatient stays, skilled nursing facilities after you've been in the hospital, and hospice care. The really good news, for most folks, this kicks in automatically at 65, totally premium-free, because they or their spouse have been paying into it through taxes their whole working lives. Then we've got Part B. You can think of B for body or basic medical care. This handles the day-to-day medical stuff outside the hospital. We're talking regular doctor visits, outpatient care, preventative services, and lab tests. Together, A and B make up what's officially called Original Medicare. But here's the catch. Unlike Part A, Part B does come with a monthly premium. The federal government sets that amount every year, and it actually scales up if your income is higher. Next in the alphabet soup is Part D, and D literally just stands for drugs. Original Medicare doesn't cover the vast majority of your parents' prescriptions, so these are private, federally approved insurance plans. You can either buy a standalone Part D policy to sit right alongside your original Medicare, or, and we see this all the time in California, it gets bundled directly into a comprehensive plan. Which naturally brings us to Part C, but honestly, everyone just calls it Medicare Advantage. And this is huge in California. These are strictly private plans. Think of your Kaisers, your Blue Shields, your scans that contract with the government to deliver all your Medicare benefits. When your parent enrolls here, they're still in Medicare, but a private network is managing the whole shebang. Plus, to win your business, they usually throw in extra perks Original Medicare doesn't touch, like dental, vision, and even hearing aids. Finally, we have Medigap, which you might also hear called a Medicare supplement. Remember how Original Medicare has A and B? Well, it has absolutely no annual cap on out-of-pocket spending. Literally no ceiling. Let that sink in for a second. So, Medigap is a separate private policy you buy to stack right on top of Original Medicare. It covers those deductibles and coinsurances, basically shielding your family from unlimited financial risk. Just remember, you can't have both Medigap and Medicare Advantage at the same time. It's strictly one or the other. And that leads us perfectly into our second section, the fork in the road, choosing your path. Here is the absolute most critical point. You aren't just picking letters off a menu. You are choosing between 2 very distinct paths. It's the biggest decision your family is going to make here. Path 1, Original Medicare. This gives you ultimate, limitless freedom. Your parent can see any doctor anywhere in the country who accepts Medicare with absolutely no referrals needed. But, as we mentioned, it has uncapped financial risk, which is exactly why you usually need to buy a Medigap and a Part D plan to fill in the holes. Path 2, Medicare Advantage. This offers serious financial safety, usually capping your out-of-pocket costs with a strict maximum, and often giving you $0 premiums. But the trade-off, restricted networks. If your dad absolutely loves his cardiologist over at Stanford, but Stanford isn't in his Advantage network, well, that relationship is effectively over, or it's going to cost a fortune. Now, before you panic, you don't have to figure this choice out alone. California has this amazing resource called HICAP, the Health Insurance Counseling and Advocacy Program. It's the official, free,
totally unbiased counseling service. They aren't trying to sell you anything. They don't make commissions. A real counselor will actually sit down with you, look at your parents' specific doctors, their exact medications, and map out the absolute best path for your specific county. They are literally your best friend in this process.
Okay, moving on to Section 3, the enrollment clock, windows and warnings. We need to talk about timelines, because just guessing at these dates, that is the single most expensive mistake a family can make. Medicare doesn't just magically activate for everyone, and nobody from the federal government is going to chase you down to remind you to sign up. The initial enrollment period is a strict 7-month window. It starts 3 months before the month your parent turns 65, includes their birthday month, and ends 3 months after. Now, if they're already taking Social Security, enrollment is usually automatic. But, and listen, this is a massive but, if they are delaying Social Security, they absolutely must raise their hand and actively apply through the Social Security Administration during this exact window. I cannot stress this enough. Late enrollment penalties are real and they stick around forever. If your parent misses that window for Part B or Part D and they don't have a qualifying excuse like active employer coverage, they are hit with a permanent, lifetime financial penalty added to their monthly premium, and there is no way around it. They literally never waive these penalties just because you say, hey, I simply didn't know. So go grab a magnet and stick these dates on your fridge forever, October 15th through December 7th. That is the annual enrollment period. Look, plans change their networks and their drug formularies every single year. The Advantage plan that was a total lifesaver for your mom this year might just decide to drop her favorite medication next year. This is your one annual window to review your coverage, swap Advantage plans, or change your Part D drug plan to adapt to those changes. Next stop, Section 4. What isn't covered? The boundary lines. Time for a quick reality check, because assuming Medicare covers absolutely everything is a major trap, and it usually catches families years into their journey, often right at a moment of crisis. Please let this sink in. Medicare does not cover custodial care. In California, a nursing home can easily cost upwards of $10,000 a month out of pocket. Medicare is strictly for medical care. Yes, it'll pay for a short rehab stint in a skilled nursing facility right after a hospital stay, but it absolutely will not pay for an assisted living facility. It won't pay for what most of us just call the nursing home, and it definitely won't pay for a caregiver whose only job is to come to the house and help your mom bathe, dress, or eat. So what if you do need that long-term daily help? Well, that answer lives in an entirely different binder, managed by entirely different California programs. We're talking about things like Medi-Cal, in-home supportive services, the assisted living waiver, and community-based adult services. These are absolutely crucial lifelines, but they are totally separate from Medicare. Don't worry, though, we are going to dive deep into all of those in future explainers. Finally, Section 5, your family's action plan, the to-do list. Okay, let's wrap this whole thing up by handing you a real compass, a completely clear order of operations so we can eliminate that kitchen table stress. Step 1 and 2, you must write down every single doctor and every single medication your parent takes. Get the exact name, the dose, the frequency. Take pictures of the pill bottles if you have to. Step 3, weigh geography against money. Do they travel out of state a lot? Do they want predictable monthly costs, or would they rather have lower premiums but with some network limits? Then step 4, take that exact list straight to a free HICS AKP counselor and have them look at the actual plans available right in your county. And for your immediate checklist this week, first track down that red, white, and blue Medicare card to confirm they are enrolled. Mark those annual enrollment dates on your calendar. And please, I am begging you, firmly hang up on those aggressive, unsolicited Medicare marketing phone calls. They are only going to confuse you. Lastly, if your parent has a modest income, you absolutely must ask HACAP about Medi-Cal. Which actually leads us perfectly to our final stop today. I want to leave you with this massive question. What exactly happens when your parent's income is low enough to qualify for both Medicare and Medi-Cal at the same time? Well, for a lot of California seniors, that combo completely redraws the map. It opens up specialized plans, wipes out almost all out-of-pocket costs, and suddenly unlocks those long-term care options we talked about earlier. It's an absolute game changer, and it's exactly what we'll be breaking down on our next explainer. Until then, just take a breath. You are not behind. You're right on time.